Bleeding in the first trimester can feel really scary, but about a quarter of pregnant women experience some bleeding early in pregnancy. The important thing to know is that not all bleeding behaves the same way. In fact, the pattern of bleeding can tell us a lot about what might be going on. So in this video, I'm going to walk through some of the common causes of bleeding in early pregnancy and what they could mean for you and your pregnancy. Now, as I mentioned earlier, up to 25% of women experience bleeding in early pregnancy. But you might be wondering, out of that 25%, how many actually go on to have a pregnancy loss? The answer depends on a few different factors, which we'll talk about in just a minute. Before we go further, I also want to say something important. As I go through this information in a very matter-of-fact way, please know that I absolutely understand the emotional weight that can come with seeing bleeding during pregnancy, the anxiety, the fear, and sometimes even the devastation when things don't turn out the way someone was hoping. So my genuine hope is that this information brings you a little reassurance and clarity as you're watching. Now, bleeding itself is a very broad description. Bleeding can mean light red spotting, but it can also look pink or brown. You might notice it on your underwear, or you might only see it when you wipe with toilet paper. Sometimes it starts very subtly. Other times it shows up gradually. It might happen with cramping or with no cramping at all, and occasionally you might notice it only after intercourse. In other words, bleeding alone doesn't define severity, and it can vary quite a bit in both color and amount. A common misconception is that any bleeding in pregnancy automatically means the pregnancy is ending or that a miscarriage is happening, but that simply isn't true. In fact, much of the time, not always, but quite often, the bleeding resolves and a healthy pregnancy continues. So bleeding in early pregnancy can show up in many different ways. But if bleeding alone doesn't determine pregnancy outcome, then what does? I'm glad you asked, because there are a few things beyond just the presence of bleeding that really matter. First, how much bleeding is there? Is it light spotting that comes and goes, or is it more like a menstrual period? Second, the color. Is the blood light pink or brown, or is it bright red? Third, changes over time. Is the spotting intermittent and fading, or is it becoming heavier as time goes on? Fourth, pain. Is the bleeding accompanied by cramping? And then another important question, how do you feel overall? Are you experiencing symptoms like dizziness, weakness, fever, or just generally not feeling well? When medical providers evaluate bleeding in pregnancy, we look closely at how the bleeding behaves over time, because the pattern over time tells us far more than simply seeing blood at a single moment. So let's look at how this plays out in real life. Light spotting that is pink or brown, just a small amount that comes and goes and eventually fades away, with no cramping or maybe only mild cramping, and the person otherwise feels completely fine, with no dizziness or fever, that pattern is usually associated with bleeding that is not concerning. This type of bleeding is most often caused by one of four things. First is implantation bleeding. This happens when the blastocyst, the very early embryo, burrows into the lining of the uterus to access its blood supply. That process can sometimes cause brief, light spotting. Second is cervical irritation. During pregnancy, the body sends increased blood flow to the uterus and cervix. That makes the cervix softer and more vascular, meaning it can bleed more easily if it's touched, for example, after intercourse or after a vaginal exam. Sometimes hormonal changes, early pregnancy comes with significant hormonal shifts, and sometimes those changes can lead to mild, intermittent spotting. And fourth is a subchorionic hematoma. This occurs when blood collects between the gestational sac and the uterine wall. Small to medium subchorionic hematomas often resolve on their own, though larger ones can sometimes lead to complications. Up to this point, we've been talking about bleeding patterns that can occur in healthy pregnancies. But bleeding doesn't always behave this way, and when the pattern changes, that's when providers pay closer attention. Bleeding should be evaluated by a medical provider if it increases instead of tapering off, becomes heavier over time, soaks through pads, remains bright red, and continues for a prolonged period. It also deserves medical attention if it's paired with worsening cramps, passing large clots or tissue, dizziness, faintness, feeling generally unwell, or developing a fever. Those patterns suggest that the bleeding is progressing rather than settling, and that distinction matters. So let's briefly talk about how miscarriages may present. This is a general pattern because not every miscarriage looks exactly the same, but often the bleeding becomes heavier over time. Cramping increases, clots or tissue may pass, and symptoms tend to progress rather than remain stable or improve. Another condition that providers always consider is ectopic pregnancy. An ectopic pregnancy occurs when a pregnancy develops outside of the uterus, most commonly in a fallopian tube. In rare cases, it can attach to other structures within the abdomen. With an ectopic pregnancy, bleeding can be light or moderate, and sometimes there may not be bleeding at all. However, there is often pelvic or abdominal pain, usually located on one side. If an ectopic pregnancy ruptures, it becomes a medical emergency. A rupture can cause severe pain, dizziness, fainting, shoulder pain, and a sudden feeling of very unwell. Those symptoms should not be monitored at home over time. They require immediate evaluation in the emergency department. So, when you step back and look at the patterns, bleeding in early pregnancy generally falls into two broad categories. Some bleeding remains light and stable, for example, light pink or brown spotting that comes and goes, possibly with mild cramping or no cramping at all. The person otherwise feels well, and over time the spotting fades away. That pattern is often associated with implantation, cervical irritation, hormonal spotting, or a small subchorionic hematoma. But bleeding that behaves differently deserves evaluation. Bleeding that becomes heavier, bright red, and persistent, soaking through pads, and paired with worsening cramps, passing large clots or tissue, or symptoms like dizziness, faintness, or generally feeling unwell, especially when symptoms are progressing instead of improving, is when it's important to reach out to your medical provider. If you're experiencing bleeding in early pregnancy and you're honestly not sure what's happening, contacting your medical provider is always the right step. Call their office or schedule an appointment. That's exactly what they're there for. Evaluation helps determine what the bleeding pattern represents and whether any additional care is needed. But hey, I hope this video helped. If it did, let me know in the comments section below. And if you're new to my channel, I've actually created a full pregnancy series where I walk through pregnancy week by week. Thank you so much for watching.